the wake of the tragic death of Indigenous woman Joye Escherquan and the fact that there are missing and murdered Indigenous women and girls in our country, what can be done about this heinous injustice? Professor Karen Lawford teaches gender studies at Queen's University and is a leader in Indigenous health who is here to help us understand more deeply what needs to be done. Professor Lawford, thank you for joining us today.
Thank you for inviting me.
So the video of Joye Escherquan was difficult to watch. A mother of 7 filming her last moments on her cell phone. What were your thoughts when you saw this and heard about it?
It was devastating. It was devastating that this happened again, and I'm sure it's happening right now. And without the courage of Joye Escherquan to actually do a Facebook Live to share this, we would not know that this happened to her. And this is unacceptable. It is unacceptable on every level of anything. It's completely wrong. And I'm so sorry to her family and her community and her partner, her children. My deepest condolences to them.
As you said, Professor Lawford, this obviously has not been the first time that this has happened. There has to have been a history. Tell us about the relationship of the Indigenous community and the healthcare system here in Canada.
So the government of Canada, when Canada was forming, went to great efforts to erase and destroy and criminalize Indigenous health and wellness practices. So Indigenous midwifery, for example, was made illegal. Taking us off our land removes our ability to be healthy and well. So there have been great interventions, midwifery just being one example, of ensuring that our knowledges and practices that kept us healthy and well for well over 30,000 years were no longer part of our knowledge system.
So this is a continuing historical tension between an Indigenous community and a system of just inequity, it sounds like.
It is, and it's also purposeful. The goal of Canada through the Indian Act was to civilize and assimilate Indigenous peoples into this generic Canadian identity. So when that happens, we are forced through various systems like the Indian Residential School and the 60 Scoop to actually then to survive, change our ways to survive. And I think a lot of us are tired of surviving.
The Joye hospital was flagged, the hospital where Miss Echaquan died was flagged for discrimination against Indigenous people many times. The Premier has apologized. What do you think needs to happen next? This is not something new in Quebec.
Yes. So I think that we're probably done with reports and words. I think people are asking for change, and they're not asking for change on just the individual level, and also at the governance level and for systemic change. Systemic racism is underpinned by white supremacy. We need to address this.
I want to go to just the fact that we saw this on video. I mean, we saw George Floyd die on video. A couple years ago, we saw Philando Castile also die on video. We have Joye Escherquan dying on video. What was it about Joyce that she thought that I need to document this experience and this ill abuse that I'm receiving?
Because no one would believe. And that's the problem. We've been told time and again, not just as healthcare providers, but as a society, as members of Canada, that this is happening. And we're choosing to not believe. We're choosing to ask for evidence and weighing that evidence against Western ideas of knowledge and information gathering. Someone's telling you, manage it, deal with it. We knew, and we're going to still know, just like with coerced and forced sterilizations.
And last question, Professor Lawford, what does this say to Indigenous women in our country?
I think the support that the family is receiving says that we matter. But you know what? In some ways, I know that we matter. I know that Indigenous people matter to this world, and I know we make a great contribution on every level of Canadian society. We matter. So what does this show? We matter. And her death, I don't know what it will mean, but we are shown again. And this is a disgusting place for us to be in, and Canadians and Canada should be ashamed.
Professor Karen Lawford teaches gender studies at Queen's University. Thank you for joining us today.